It's Etch back with another health highlight from Michigan Primary Care Partners and Y102. This week's topic you may have seen on signs alongside of the road saying, come get your shingles shots here. And that's what it's all about. What is shingles? Who suffers the most? How is it treated? How does it lead to chronic pain? That's what we're going to find out in this week's health highlights with Michigan Primary Care Partners and Y102.
Shingles presents as typically a painful rash in a dermatomal pattern or along a certain nerve root, although sometimes you can have significant pain and no rash, which makes it harder to diagnose. Typically patients 50 or older are at higher risk for this, but it can happen to younger patients as well, even in your 20s or 30s. It is unknown what sets this virus off. But sometimes stress or activity or something going on in your life that may cause this virus to activate and cause the rash and the painful syndrome. And also, even if it's treated, it can be a long-term pain syndrome that we see in the pain clinic as well. And those can help reduce the symptoms and the risk of chronic pain. The pain can last for several days to several weeks, and in very rare case can be a lifelong chronic pain issue. If you have open lesions that have those small vesicles or pustules that are opening up and leaking some fluid, you are contagious, and you should also warn anyone that's pregnant to stay away from being around you. Even if you've had varicella or chickenpox in the past, you definitely need to worry about it because this is something that could activate 30, 40 years later. And that's why the vaccine is recommended for patients 50 and older. The Shingles vaccine is available at most pharmacies and at some primary care facilities. If it does get to significant pain that's ongoing, we can use some nerve pain medicines that are indicated for this, including gabapentin and Lyrica. Typically those medications can be prescribed by primary care initially, and if those kind of first-line agents are not working, then we would consider pain management referral for intercostal nerve blocks or taking it a step further to avoid the lifelong chronic pain syndrome. If you can get the vaccine and avoid ever getting the syndrome, that's the easiest and best step to avoid needing further treatment.